Good evening. Namaste. This is Dr. Aparna. I am an Ayurvedic psychotherapist. I am your emotional healing synergist. I am an Ayurveda and psychotherapy infopreneur, medical writer, and now a budding YouTuber. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions every week, either on Ayurveda, mental health, psychotherapy, and related aspects. So, yesterday, in our previous session, we were discussing on borderline personality disorder. So, we discussed what is borderline personality disorder, what is the global incidence of it, what are the signs and symptoms. You know, briefly, I touched upon the causes of borderline personality disorder. Today, we are going to discuss case studies how because yesterday if people who had followed me would know that I said that all the signs and symptoms may not exhibit in every individual. It is different from individual. The signs and symptoms are different from individual to individual. It varies from person to person. So let's see some real case studies, how borderline personality disorder may exhibit in different people, and what are the signs and symptoms, what all can be seen, because it is important for you also to know how to when to approach a doctor, so you will get an idea, a brief idea of what is it going to be. So see, borderline personality disorder, as I said, to recap, is a mental illness. So what does it do? Yesterday we discussed that severely impacts a person's ability to manage his or her emotions, to manage their emotions. So the loss of emotional control, what it can do, it can increase impulsivity. So, and it can affect how a person feels about themselves and negatively impact their relationships with others. So let's take our first case study. Let's name this person as Parrot. So, Parrot, the first symptom she has is she has intense fear of abandonment. That means a parrot becomes extremely anxious and distressed even at the thought of her friends making plans without her. If she happens to know that her friends or relatives are making plans without her for going out or celebrating a birthday party, what happens is a parent becomes extremely anxious and distressed. Why? Because she has an intense fear of abandonment. She feels that she often feels rejected. So what happens? This leads to impulsive behaviors, and to prevent perceived abandonment, so she behaves impulsively, so that and or she might also do some things to attraction, to attract her friends, and these and in these impulsive behaviors, it could be self-harm behaviors as well, just to gain attention from her friends, so that she can prevent her perceived abandonment. This is not actual abandonment. That is not that this is not, this might not may be rational. That means it could be that her friends are not doing that, or her relatives are not doing that, but she's perceiving that they will they are making plans without her. So this is one of the symptoms of parrot. Second, what she faces is unstable relationships. So because of this, her relationships are characterized by extremes. If you were there yesterday, if you have followed yesterday's session, you would know that I talked about the extremity. If they like you, if the people with BPD like you, they will idealize you like a god. The next moment, if they dislike you, they dislike you completely, because their relationships are usually characterized by extremes. Here, what she does is she idealizes friends initially, but quickly turns against them over minor disagreements. So, even over minor disagreements, she extremely dislikes the person whom she liked few moments ago. So, what happens is she struggles with maintaining stable and healthy relationships. So the one more symptom what she has is emotional instability. These are all, due to emotional instability. So here parrot's emotions fluctuate drastically. So she experiences intense episodes of anger, anxiety, sadness within short periods of time. So her mood swings can be triggered by seemingly trivial events. So these are the symptoms, in one person. Here there is no identity disturbance or impulsivity, the other symptoms. So this can be, if you see these symptoms in yourself or in people surrounding you, so this might be, a borderline personality disorder. So we'll take another case study. In this case study, here, let's name this person as Tiger. So, Tiger presents with signs and symptoms. So, here the first symptom is impulsivity. So, what Tiger does is Tiger engages in reckless behaviors without considering the consequences. The impulsivity we discussed yesterday. So, he spends impulsively. They do not consider the consequences. He may drive, recklessly, indulge in speed driving, and he engages in substance abuse and has frequent unsafe sex. So all these are done without considering the consequences. So these are impulsive behaviors. So the next thing is, they see here, tiger has identity disturbance. That means he often feels uncertain about who he is. We discussed about this yesterday as well, as a symptom. So they always have identity issues. So, and he's frequently changing career goals, he's frequently changing his hobbies, he's frequently changing his values to fit in with different social circles. As we discussed, these people with PPD always long for external validation. So what happens is this person is frequently changing career goals, hobbies, values, just to fit in the different social circles. So this instability in self image causes distress. So the next thing this person experiences is, the next symptom Tiger has is self harm and suicidal thoughts. So this is different from the first case we discussed of the parrot. So here Tiger has a history of self harming behaviors such as cutting. Yesterday I said, in the previous session we talked about either cutting or burning the finger or hand, or and trying to self harm, because they feel this as a coping strategy to get out of the emotional agony. So he here experiences persistent thoughts of suicide, especially during emotional crises. When they think that the emotions are overtaking, they feel that they have to commit suicide or self harm, or they have suicidal thoughts at least. So this is the second case of Tiger. This is a presentation, a case presentation. What we get, some symptoms with some symptoms, but these are serious, quite serious. So what I'm trying to say is, this borderline personality disorder might vary from mild symptoms to moderate symptoms to severe symptoms, all of these. So the next case study is, we are discussing about, let this person be, you know almond. So We are discussing about Almond's case now. So in this case, Almond often feels he has chronic feelings of emptiness. Yesterday I said, in the yesterday session also, we discussed of the all usually people with borderline personality disorder always feel a sensation of emptiness inside them, though emptiness of purpose, or and they do not have a purpose, or they do not have clarity on themselves, and they always feel empty from inside. So here also, Almond describes feeling empty and numb most of the time. So despite external successes, there is an underlying sense of dissatisfaction. They're always dissatisfied and feel hollow. This person, Almond, is always has an underlying sense of dissatisfaction in despite of being successful, fairly a successful professional. He always feels emptiness and hollowness from inside, so he has dissatisfaction. And next symptom he presents with is difficulty regulating emotions. So he struggles to control his emotions, often experiencing emotional outbursts so that are disproportionate to the situation. He feels overwhelmed and unable to manage these intense feelings. So these people, person with BPD also have difficulty. The main symptom itself is difficulty in regulating emotions. So they cannot regulate their emotional outbursts. They find it very difficult. They might be express their behaviors in anger, anxiety, and impulsivity, all these. So there are emotional outbursts, and they are disproportionate to the situation. That means if the situation is not so, it is not because of the situation there are emotional outbursts. That means if there is a loss of a family member, or if there is something bad happening, or some serious situation, we all have emotional outbursts. Normally it is normal, but here they are disproportionate to the situation. If the situation is not even as if it is very small, but the emotional outburst is very very much, so it is very disproportionate to the situation. So here he feels overwhelmed and unable to manage these intense feelings. All these feelings are irrational, so they are unjustifiable. Something called paranoia, we can say. So, which the emotions which are maybe delusional, or maybe irrational, or non justifiable emotions, so disproportionate to the situations. So he next has, because of this, he has all paranoid thoughts and dissociations. So dissociation is they are away from the reality. So here what happens is, here this person faces occasionally this occasionally experiences episodes of dissociation. That means feeling detached from the reality of who they are, and feeling detached from the surroundings. So they do not feel attached to the reality, to the surroundings, to the they may always feel isolated or dissociated, and feeling detached, majorly feeling detached from the real situation, reality. So this person also harbors suspicions, suspicions about others intentions. They may feel that the other person is going to harm me, is going to kill me. So all these delusional thoughts will be there, which are not justifiable or irrational. So they are all perceived in the mind, they are perceived, not real. So other person is thinking bad of them, other person will harm them, other person is trying to kill them, is thinking ill of them. All these thoughts, all these suspicions about others intentions, and sometimes they feel paranoid. That means delusional. So See this disorder, see this borderline personality disorder is a complex, you can say a dance between intense emotions, and fraught relationships, difficult relationships, impulsive behaviors. So this is not a simple diagnosis, but with intricate, it is very complicated and intricate because it plays out in very diverse ways as we see. So, and let's see some more cases. So here we have one more case study, one more our client, who let's name her as Pista. So Pista here experiences intense mood swings and has a fear of abandonment. She usually engages in impulsive behaviors. What she does, she has a fear of abandonment, and she has a fear of emptiness. What people do, if you are feeling empty from inside, person wants to fill the emptiness with something. So what she is doing here is she is a spending spree, she's overspending, she's doing shopping. She might take financial loans for shopping, and she is not worried of the consequence. And she is also here this person Pista is into substance abuse. So because to fill her emptiness, and during the moments of stress, she might threaten her relatives, her friends, or her partner, to that she will self harm her, just to get the attention of people surrounding her. So here this person Pista, each we can think that this person is around 28, 29 years old, had a pattern of this person has a pattern of unstable relationships. What happened is, just an instance, when her partner arrived late for dinner date, she became extremely anxious, accusing him of not caring and threatening to harm herself. So this could be a small instance, this could happen, you could have experienced this as well happening with you at times, people surrounding you having this, when just her partner arrived late for a dinner date and she became extremely anxious, accusing them of not caring, threatening to harm herself. So her emotions oscillated between extreme anger and desperate pleas for reassurance. What happens after there is an emotional outburst of anger? This person also feels guilty, and she is very desperate to please and for reassurance. Again, she wants the same partner who arrived late for dinner, and she is desperately pleasing that person. One moment she is extremely angry, and the other moment she is desperately pleasing that person. So this is one more case study. And another case study we are discussing is a person. Let's name this person as Apple. So Apple has an unstable self image. So I said there are self image issues and struggles with identity issues. So this person frequently engages in reckless behaviors such as driving recklessly and getting into fights. So he feels empty and experiences chronic feelings of boredom. So to fill the boredom and emptiness, he always engages in reckless behaviors, driving recklessly, getting into fights, gambling, substance abuse, all these things to fill the emptiness. So here, this person Apple, let's presume this person is a 25-year-old had come with us with a 25-year-old person struggling with finding his career path. The main complaint was he struggled to find his career path. So he often changed his goals and interests drastically. So today he want to become something else, and tomorrow he has changed his goal and career perspective to something else. So his goals and interests changed drastically, from wanting to be an artist one day and to pursuing a corporate career. So the goals and interests changed drastically. So this constant shift in focus left him feeling empty and directionless. So the constant shift in focus or career or goal left this person feeling very empty and directionless. So he has an unstable self image, and he frequently engages in reckless behavior such as driving, gambling, getting into fights, shopping, all these things. So our next case studies, these are some of the case studies which are, presented to us like this, because the theory we study and practically what we experience is different, totally different. So we also have to go through multiple analysis techniques to come into a diagnosis of borderline personality disorder. So this is complex. So another case study here is a person called, Strawberry has recurrent suicidal ideation. This is something serious. Has recurrent suicidal ideation and engages in self-harming behaviors like cutting. So she experiences intense rapid mood swings, often triggered by seemingly minor events, also for minor events, as only a friend did not involve her in a picnic plan, or a relative did not give her enough attention or enough validation, her partner came late for dinner. Also this, for the minor events, for very seemingly minor events, this person engages in self-harming behaviors. So she experiences intense rapid mood swings, often triggered by seemingly minor events. So here, this person, Strawberry, who came to us, who was age 30, had a history of self-harm. Whenever her friends cancelled plans at last minute, she felt rejected and spiraled into a severe depressive mode, resulting in a self-injurious behavior. So this is a serious case of BPD here, self-harming type of, thing. So we have to actively intervene. So the next case study here is, uh, we have a person called, let's say, Cashew. So Cashew has difficulty in controlling anger and experiences frequent outbursts. So this person has frequent outbursts. So he has intense and stormy relationships, shifting between idealization and devaluation of others. As I said, this person will once consider his friends or partner or his relatives as, ideal people to be around, or like gods, and he will extremely like the person, and in moments he will devalue the person, he will extremely dislike the person, he will think that a person is entirely negative. So this happens. So here, our Cashew is a 32-year-old man who had hard relationships, so unstable, tumultuous relationships with his colleagues. Here he would idealize them one day, expecting constant validation, and then turn hostile when he perceived any slight causing conflicts and disruptions at work. Actually, you will find people like this, but you will not know that that person has PPD, or he or himself might not know that he has, borderline personality disorder. This is something, he would idealize the colleagues one day, he would expect constant validation from them, and he will turn hostile when he thinks that there is slight, invalidation, or there is slight in change in the ideology, or attention or ideas, or causing conflicts and disruptions at work. So this, constant emotional instability is seen. So the next case and the last case we are discussing for today is, so and we have one more case. So here we'll think, this person is Vanilla. So Vanilla often experiences dissociation during stressful situations. So she has unstable and intense relationships and is highly sensitive to perceived abandonment. So this person experiences, dissociation is not associating to the reality, or they are away from the reality, real situation. So this person has unstable and intense relationships and is highly sensitive to perceived abandonment, is fear of abandonment, fear of people leaving her alone and being rejected. So here Vanilla came to us as a 27-year-old who struggled to maintain her relationships due to her constant fear of abandonment. So during arguments with her friends, she would dissociate, feeling disconnected from the reality. Dissociate is nothing but feeling disconnected from the reality and unable to control her emotions. So this is one type of case study. The another thing is, the interesting case is, here there is, we have a perfectionist prisoner here. A person, let's consider this person as Chiku. So Chiku thrives on achievement, setting impossibly high standards for himself and others. So this is also a case of PPD. So this person thrives on achievement, and he is setting impossibly high standards for himself and also others. So his fear of abandonment fuels his perfectionism. So what he as he fears being rejected and being abandoned, that is the reason for his perfectionism. So he that drives him to work tirelessly. So however, any perceived failure triggers explosive anger, so that destroys his professional relationships, jeopardizing his professional relationships. So here this person avoids intimacy or feeling vulnerability and struggles to express his emotions in a healthy way. This person struggles to express his emotions. Chiku struggles to express his emotions in a healthy way. So he lives in a self-imposed prison of perfection. So this is also a case of BPD. When we got this, it was very difficult to make a diagnosis. So this person lives in a self-imposed prison of perfection. So desperately seeking validation but pushing it away. When he gets the validation, he just pushes it away. So this is a case. And another interesting case we got is this person, of the person. Let's name her as some, Maya. So the mirror. So the Maya is a compassionate soul. She's very compassionate. She absorbs the emotions of other like sponge. So she is a people pleasing person. So she bends over backward to please everyone. She always neglects her own needs and setting unhealthy boundaries. So this constant self sacrifice leaves her feeling drained and empty. Because she is very people pleasing, what she does is to please everyone. She always neglects her own needs. So, and she is setting a unhealthy boundary. So she can't say no, because she thinks that if she doesn't please people, they will abandon her. So the fear of rejection causes this, and this constant self sacrifice leaves her feeling drained and empty. So here Maya struggles with dissociation, escaping overwhelming emotions by feeling numb or disconnected from herself and the reality. So what she does is she starts mirroring the personalities of those around her. What she does is she acts like the people she sees around her, maybe like her mother, maybe like a friend, maybe like her sister. She starts mirroring the personalities of those around her. but she lacks a clear sense of her own identity. Again, there is an identity issues. So the constant sacrifice leaves her, first of all, drained and empty. Then she is dissociated from the reality, and she wants to escape from the overwhelming emotions. So what she does is she mirrors the personalities of those around her, but she does not have a clear sense of her own identity. So these are some case studies, like interesting case studies, how they may present. And for you to understand, all these also can be borderline personality disorder, because these are very common. This is common. So what might happen in this emotional dysregulation may happen, intense and shifting emotions that are difficult to manage, fear of abandonment. So the worry to be of being left alone, and that leads to unstable relationships, impulsive behaviors, identity disturbance, dissociation. But BPD, remember, a point to remember is BPD is not a label that defines a person. With support, and with proper support and treatment, individuals, people with BPD can learn to manage their symptoms and build fulfilling lives. Yes, that is possible. So seeking professional help is very crucial here, to navigate the complexities and find a path towards recovery, you know seeking professional help is absolutely essential. So that brings an end to the session, today's session. But I'll discuss what are the types of BPD in the next session, and what is DBT, dialectal behavioral therapy, what I talked about, what are the components of BPT, and how is it useful in BPD. All that we'll discuss, and other psychotherapy methods such as CBT, what we do in borderline personality disorder. We'll discuss all these in the upcoming sessions. So stay tuned. Namaste for today.